Heart failure is not only a common medical condition, but also an important public health issue. There are, at the moment, 38 million patients all around the world who suffer from heart failure. Unfortunately, we do not have any figure from this part of the world, and that is primarily because of the lack of awareness, not only amongst the general public, but also amongst the health professionals. It is now well known that heart failure is now the second biggest killer in the world. It unfortunately kills more than some of the common cancers that we know of, like prostate cancer, breast cancer, bladder cancer, and so on. The good news, however, is that heart failure is preventable if we increase awareness amongst the general public. Now, what is heart failure? Heart failure is basically the poor pump function of the heart muscle, and it is primarily because of either the weakness of the heart muscle or the stiffness of the heart muscle. So the heart muscle, which forms the pump, does not pump enough blood, or it does not stretch enough to fill blood. Now, what are the common symptoms of heart failure? The most common symptom is the shortness of breath, particularly when the patient is walking or climbing up the stairs, or when the patient is lying flat on the bed. He or she may be woken up feeling out of breath. The other symptoms are swelling on the legs, and as a matter of fact, it can lead to swelling all over the body. It will lead to easy fatigability, general tiredness, weight gain or weight loss. Now, the signs can be picked up by the physicians are the swelling of the legs and the fluid that collects on the lungs. Now, it is very important that the patients do become aware of heart failure. So it is good to recognize if there is any weight gain which is very unusual by about 1 to 2 kilograms, if one notices swelling on the legs, or one starts to feel short of breath where there is no very obvious cause for the shortness of breath. Common investigations that are done are some blood tests. One of the blood tests is very sensitive to pick up if somebody suffers from heart failure or not. Other tests are ECG or electrocardiogram, chest X-ray, scan of the heart, which we call echocardiogram, and so on. Treatments are unfortunately not many, and unfortunately heart failure, as we all know, is not curable, but as I said in the beginning, it is preventable. Therefore, it is important that we recognize the early symptoms and signs of heart failure and we act on time. So if you develop any symptom such as shortness of breath, or if you see that your weight increases for no reason, so you must act upon it and call for help. You speak to your local general physician or any physician in the hospital and get urgent care and attention. Thank you very much.